The American Society for Dermatologic Surgery held their annual conference earlier this month. So, leading dermatologist Dr. Macrene Alexiades joins us now to discuss some of the latest and most exciting aesthetic trends hitting the doctor's offices. Doctor, thank you so much for being with us.
It's great to be here, Tina. Thanks for having me.
Well, before we actually get to some of these hot trends that I'm sure you guys went over at the conference, can you kind of give us a little bit of a background on the society?
Oh, sure. ASDS, or American Society for Dermatologic Surgery, it's a group of physicians, myself included, who are professors and leaders in the industry, and we present every year at this annual meeting the advances in dermatology, skin care, skin surgery.
Well, then we know we're getting some good stuff coming out of this conference. So I'm excited to find out what was talked about. What were the hot trends?
Well, the hot topic this year, and very timely, was just as the meeting commenced, the FDA announced the approval of Botox Cosmetic for the first time in history for the temporary treatment of the improvement of forehead lines. It's for anyone who's bothered by lines in the forehead. And although Botox Cosmetic had been approved in 2002 for frown lines, it wasn't until 2013 that Allergan, the maker of Botox Cosmetic, achieved the FDA approval for crow's feet. And now it's the first and only company to have an even third approval, and that's for forehead lines. So they did a huge study and actually showed that the vast majority of patients, about 74%, request the treatment of frown lines as their focal area to be treated. But 59% actually request forehead and 54% crow's feet. So all three of these areas on the skin are really important areas for the consumer that they complain about lines in those locations.
And so I love that you're telling us that it's had these advancements and these approvals along the way. This is a big one because, like you said, a lot of people deal with this or of course, want to have this fixed with the Botox. Was this the only thing that we talked about at the convention? Is there anything else that big came out of there?
Yeah. We cover all the advancements in the industry, so you can basically group aesthetic medicine into three main categories, and that's injectables, which includes things like Botox Cosmetic or fillers for nasolabial folds, lips, such as Juvederm, and then there are other injectables that you probably haven't heard about yet, like Kybella, which I was in the FDA trial for Kybella as a principal investigator. It's an injectable that you can use under the chin to melt fat. I'm also a laser specialist, so another big group of treatments that we discussed at the meeting are the lasers and light and energy-based technologies. And for example, something like Cool Sculpting, which is a cold device that eliminates fat in areas like the abdomen. That was discussed in advancements in this area. And then at the meeting, we always talk about skin science when it comes to skin cancer. So we'll talk about advances in dermatologic surgery for skin cancer as well.
Is there somewhere we can actually go online to kind of get more information on some of these new trends, what's available to us?
Absolutely. So for the recent approval for forehead lines, you can go to www.botoxcosmetic.com. For information about the ASDS, our society in general, it's asds.net. And if you want to learn about my credentials and my commitment to science and research, you can see my website at www.nyderm.org. That's newyorkderm.org.
Doctor, thank you so much for this information.
It was a pleasure to be here, Tina. Thank you for having me.
We'll be right back.